Hi, I'm Jordan Klebanoff. I'm an OB/GYN resident from Christiana Hospital, and welcome to this week's episode of Pocket Pearls. I'm here with Dr. Carrie Campbell and Sophie Blakey, one of the fourth-year medical students from Jefferson. Today we're going to be talking about cervical ripening and induction of labor. About 1 in 5 pregnant women will undergo an induction of labor, and the endpoint or the goal of induction is for a vaginal delivery. So Sophie has some questions for us today about cervical ripening and induction.
What is cervical ripening?
Well, that's a good question. Cervical ripening is the process of dilating, thinning, and effacing the cervix. The goal of cervical ripening is to reduce the rate of failed inductions of labor and to reduce the time from induction to delivery.
Why would you ripen the cervix?
Whether or not you need to perform cervical ripening depends on whether the patient has a favorable or unfavorable cervix. The way that we assess the cervix is based on the Bishop score. And in general, if someone has a Bishop score of 6 or less, their cervix is considered unfavorable and they would need cervical ripening before their induction of labor.
How do you ripen a cervix?
There are multiple methods that we can use. One method is mechanically using a Foley catheter that you inflate with 30 milliliters of saline. Another method is osmotic dilators using laminaria, and you can also use extra amniotic infusions of normal saline. We also can use prostaglandins like Cervidil or Cytotec.
Is one method of cervical ripening better than the others?
That's certainly something that's important to consider. There's pros and cons to each method of cervical ripening, and certain methods have their place in certain situations. It's a little bit too much detail to go into here, but in subsequent videos we'll go into the subtleties of the differences between each mode of cervical ripening.
Once you've ripened somebody's cervix, how do you induce labor?
There are a couple different ways to induce labor, and if someone's already gone through cervical ripening and now has a favorable cervix, or if that patient presented with a favorable cervix, one of the common medications you'll see is oxytocin or pitocin that's used through the IV to initiate labor or induce labor. You can also do stripping or sweeping of the amniotic membranes. That causes some prostaglandin release, which can induce labor. You can also just perform an amniotomy, which is an artificial rupture of the patient's membranes to induce labor. And in certain clinical settings with the right patient and the right physician, you can also perform nipple stimulation to induce labor.
What are the indications and contraindications for inducing labor?
Well, there are many indications for inducing labor. When you are considering induction, you should always think about gestational age, maternal fetal conditions, cervical status, and many other factors. Contraindications to an induction would be the same contraindications to any vaginal delivery. These would include vasoprevia or complete placental previa, transverse lie, umbilical cord prolapse, active herpes infection, a previous classical C-section, or a previous myomectomy that entered the endometrial cavity.
Do you do anything different for women who have already ruptured their membranes?
Well, the largest data studies show that in comparison to expectant management, you should induce them. They were also showing that pitocin has shown to decrease the interval between induction and delivery, as well as the frequency of chorioamnionitis, neonatal infection, or antibiotic use, and it does not increase C-section or neonatal infections.
To summarize what we learned today, there's a difference between cervical ripening and inducing labor. You need to ripen the cervix of women who have a Bishop score of 6 or less. Those cervices are considered unfavorable. When it comes to how to induce labor, there's many different ways. What we commonly practice here at Christiana is to use a pitocin induction protocol. When you encounter a woman with ruptured membranes, there's really no harm in inducing her labor. When compared to women who are expectantly managed, it actually reduces the time to delivery without increasing things like postpartum fevers, neonatal morbidity or antibiotics, and C-section rates. Join us in future episodes as we talk about the subtleties of each method of inducing labor and cervical ripening.
What methods are there for ripening a cervix?
Well, there are multiple methods. There is one method called using the Foley catheter or a Foley balloon. What?
Why would you ripen the cervix?
Why would anyone?
You can also perform nipple stimulation to induce labor. I'm here with one of my co-residents, Dr. Go back. She's just one resident. Welcome to this week's episode of Pocket Pearls. Okay. It's going to be better this time.
I hope so.
All right, here we go. Welcome to this week's episode of Pocket Pearls. I'm here with one of my co-residents, Dr. Carrie Campbell. Did I say it again?
You did, but I'm technically...
Bastard.
Come on, Jordan.